to come to you today and speak to you on the subject of the COVID-19 crisis and give you an update on how COVID-19 and its restrictions are affecting our community. You're probably aware that a amendment to the health order has come into effect today. It was announced last Friday by our governor. So I wanted to share with you about that and share some reaction to that and talk to you about what the city of Clovis is doing and hopefully offer some encouragement today. Before we get into any of that, I did want to have Mr. George Cruz, administrator from PRMC, provide us with an update on things as they are happening out at the hospital. And I believe we have Mr. Cruz on the line. Mr. Cruz, if you're there. Mr. Cruz, we would have you push *6 to unmute. And if you're ready, I would love for you to share your update from PRMC. Okay. Must be having some trouble getting Mr. Cruz connected. And since that's the case, we will move on and we'll see if we can get him on the line or get him connected by video perhaps. Wanted to kind of talk to you about where we're at with numbers with COVID-19. In the month of November, we have already hit 667 new positive cases with COVID-19, and for perspective, we had 779 in the month of October. And so and that was a large increase over the number in September. So we definitely have a trend going with the numbers and the spread in our community. Before I move on, I'm going to try one more time. Mr. Cruz, are you there to give us an update from PRMC?
Mayor Morris, can you hear me?
I can, Mr. Cruz. It's good to hear your voice. Thank you for taking time out of what I'm sure is a busy day to join us and provide us with a little bit of an update. Provide the public with an update, that is. Go ahead.
Absolutely. Thank you, Mayor Morris. So currently, right now, we sit at 27 COVID positive patients in the house, 5 of which are in the ICU. So a little bit lower than we were last week, but still sort of a bit concerning as we use projected data that shows us day by day exactly what number is projected for each day, and we're actually ahead of the numbers that the data is projecting. So by the end of the month, the projection, if it continues to align with the model that we're using, it looks like we'll be at 36 patients in our general inpatient and 15 patients in our ICUs. Now, if that comes to fruition, obviously that's a bit concerning. And with the way that the numbers have been trending here most recently and over the past several weeks, obviously it's a bit concerning to us here at the hospital, as those numbers can cause a bit of an overwhelming feeling for us. Especially coupled with the fact that, surrounding area facilities are at capacity as well. Now, we're not at capacity right now. We're nowhere near capacity. We actually entered the day at 50% capacity. So over 50% of our patients are COVID positive patients. And so obviously a very concerning trend nonetheless. And so, I think I think the message needs to be that we want you to understand that obviously the growing trend is, as far as COVID positives, is growing rapidly in our area. And the biggest concern we have is the overwhelming capabilities that it could have on our health system.
Understood. Mr. Cruz, you said that you're currently at about 50% capacity in your facility?
Yes.
And what percentage of the patients in-house are COVID patients?
So a little over 50%.
Okay. So a little over half of the folks in the hospital in Clovis today are there because of COVID-19.
Yes, Mayor.
Okay. And you mentioned that your the Presbyterian models predict 36 regular general bed patients and 15 ICU. Did you say 15?
Yes, sir.
Okay. And that would be what percentage of your capacity at your best estimate?
Probably somewhere in the 70 to 75% range.
Okay. Okay. And you mentioned that you're running into trouble transferring patients out. I know that PRMC is, committed to taking great care of your patients. Do you have instances where you've wanted to transfer out, but those have been denied? I mean, is that what has led to there being 27 in the hospital today?
So the 27 in the hospital today are not any that we considered transferring, but we have run into situations recently where facilities that we historically have transferred to are either at capacity or pretty close to capacity. And so that being said, we have partnered with Dancy Trigg and Tucumcari to help offload some of those patients, whether it be us clearing up beds to accept COVID patients or them accepting some of our general inpatients just to sort of serve as a relief valve for us.
Okay. Okay. Great. Thank you for the update. How are you doing staffing-wise? When we've talked recently, you've expressed that staffing is a challenge for a number of different reasons. How's your staff?
So definitely staffing is a challenge. I mean, we have enough staff. That's not necessarily, I mean, it's, I don't want there to be a misconception that we don't have enough staff, but obviously when you're dealing with COVID patients require additional resources. And so it can pull your staffing, your normal staffing model a little thin. And so we're doing okay as far as staffing is concerned. Now, we have recognized that the increase in numbers has sort of, we've made the decision to hire contract labor to help with some of the workload. And that contract labor will be arriving here starting this week and through the first week of December.
Okay, great. Appreciate that. I wouldn't keep you too much longer because I know you have things to do, Mr. Cruz. What would you ask of the public at this time, given what's going on?
Well, I know it sounds cliche right now, but simply we plead that the public just simply follows COVID safe practices so that we can hopefully minimize or at least have a positive impact on the trending numbers that we see currently. It's something as simple as putting on a mask. I always tell people it could mean the difference between losing a life and saving a life. And so that's my only ask, is that we just practice COVID safe practices.
appreciate that. And you have my support on that and the support of many others. And we thank you for what you're doing. And our thoughts and prayers are with you and your team out at PRMC. We appreciate you very much, Mr. Cruz.
Thank you, Mayor Morris.
I happen to think that the statistics and the numbers at our local hospital really tell the story for us. There's been a lot that's been lost in the news and in hearsay as it pertains to coronavirus and COVID-19. And I always appreciate hearing exactly what's happening at our hospital in our town, because I think that really gets at what the impact is here locally, and that is the best way for us to be informed and have that information inform our actions and our decisions. As I was saying, in the month of October, Curry County reported 779 COVID-19 cases, and through the 15th of November, we're already at 667. So obviously the trend there is a pretty sharp spike up in numbers. And it was in late October that we started to hear from Mr. Cruz at PRMC about the increased number of patients in the hospital with COVID-19, and he started to express concerns about that. And so since then, he's been gracious, and I've been in frequent contact with him to ask, what's going on, how are the numbers trending, and he's been great to give us those reports. So with that in mind, last Friday, the governor announced a new amendment to the health order. That health order actually took effect today, November 16th, and runs through November 30th. The amendment, as it was explained by the governor, is aimed at responding to the alarming spread of COVID-19 in the state. And of course, our part of the state is experiencing that spread. And it deals mostly with restrictions on gatherings and also restrictions on business operations, all aimed at slowing the spread again. So I would refer you to the health order itself for a full understanding of the health order and how it may apply to your situation. But I did want to share some key points from the amended order that I think are important to understand and apply to us all. First of all, we are currently under a stay-at-home order. So that's important to understand, is that we are in a situation in the state where the governor and the health department have put in place a stay-at-home order. Mass gatherings are prohibited. Previously, the gathering limit was 5, and that's been removed. Gatherings are prohibited. All businesses and nonprofits, except those deemed essential, must reduce in-person workforce by 100%. So some pretty strict tightening of restrictions on our businesses there. Businesses not deemed essential are, however, I think this was important, are, however, allowed to operate to the minimum extent necessary to provide curbside pickup and delivery of services to customers. And that's when the business is legally permitted to do so. Another change that I thought I would point out and make sure everyone understands is that retail businesses, which are deemed essential, also have new, tighter restrictions. So the grocery store, the big hardware store, our big retail stores here in town are now effective today under a new restriction which says that they may not exceed the lesser of 25% of their occupancy or 75 customers. So that's a pretty drastic change, and one that the public should be aware of. If you're going out to shop at any of these retailers, you're going to run into the fact that they're metering and having to limit the number of customers that they allow in the store at one time. And I would just ask that you understand that they're being required to do that by the state, and it'll be frustrating. Please give them grace and be patient with them. Also, these stores are under an order that says that they may not allow customers in to shop unless they're using a face covering. So please be aware of that as well. Houses of worship were addressed with the amendment, and they're restricted similar to the retail businesses, the lesser of 25% of their occupancy or 75 individuals at any one time. Food and drink establishments may not provide dine-in service, but they can provide carry-out and delivery services. Again, that's not an exhaustive explanation of the amendment, but those were some points that I thought I would bring up because I feel like they are important for us to all understand, and they apply to all of us. So again, I'd refer you to the order to gain a full understanding of the order. Over the weekend after this announcement, I've had the chance to visit with business owners and church leaders and citizens who have shared their reactions to this with me, and to be honest, reactions are all over. They're all sides of this, and frankly, it's frustration on all sides. And you know, I'm frustrated too. I'm frustrated to, you know, hear the reports from the hospital that, you know, people in Clovis and our area are sick and sick enough that they need hospitalization. You know, I'm frustrated to see, you know, what that means for us in the way of public safety when our hospital begins to, you know, reach capacity and staff is overburdened and overtaxed, and so, you know, that's frustrating. I'm also frustrated that businesses once again are being made to close or drastically limit their operations. I find that very frustrating, and you know, I'm frustrated that the phrase non-essential business has made its way to the top again. I don't believe that any business is not essential. And I believe that if you ask the owner of any business or the employees of any business, they would say that they are essential. And so it's difficult for me to take that. And when I've visited with business owners, I've expressed my empathy there. From my position on the Mayor's Council, I've been on the Mayor's Council since the beginning of May, and since then have had at least weekly, sometimes twice a week meetings, and there I've argued over and over for, you know, less restrictions on business, especially after we started opening up, and I saw Clovis businesses adopt the COVID safe practices and do a great job with that, do a great job of operating their business safely. And so it was frustrating for me to see this come down and see the restriction on our businesses. I've argued against the tighter restrictions and in favor of more, you know, wonderful factual information for citizens to have and allow that to impact their decisions. You know, I've wanted to see more of a recognition of individual responsibility in the health orders. I think that New Mexicans, I think that the people in Clovis can be trusted. If they have enough information, they can be trusted to do the right things and to look out for one another. And that's been my message even last week. In the days leading up to the Friday announcement of this new order, I argued with the governor's staff about this, and you know, I argued that imposing restrictions on our small businesses seems completely unfair. It's not the business's fault that the spread is happening. I suppose there are a few exceptions, and there are some businesses that maybe could be doing better, but for the most part, by and large, the majority of Clovis businesses that I've been to, customers are using face coverings. There's distancing in place. It's clean. I think Clovis business owners are doing a good job, and I think that it's unfair that they're being made to restrict their operations once again. businesses have been through too much already this year. And so what I would say is that I hear the frustration from the business community. I hear the frustration from our citizens on all sides of this issue. And I want you to know that I'm frustrated too, and that I've done my best, and I'll continue to do my best to advocate for what's right and what's fair for our city and for our citizens. That being said, we can't stay in a place of frustration. We can't stay there. We have to find a way forward. We have to find a way to be optimistic and positive and hopeful as we move forward. And the governor has laid out the state's plan and the state's strategy for curbing this recent spike in the state. This is the state's strategy. And we know that, and so we know the rules that we're playing by for the next couple of weeks. And the bottom line is that we don't all necessarily agree with how it's been handled, but this is the state strategy. So we can't be stuck in negativity and in disagreement. We do have to find a way to move forward. And we do have a public health crisis on our hands. You heard the report from the hospital administrator. I'm hearing from him frequently. He's had as many as 34 inpatient when I've talked to him as late as Saturday. He told me about 34 patients in the hospital. So we do have a public health crisis on our hands. And as much as possible, I would like to see us move past negativity and disagreement with government, and too often disagreement with one another. We need to find common ground and a common goal and move forward in a positive way. Let's shake off the ideas that some of us have had, such as, COVID really isn't that big of a deal, or maybe it's just political. That isn't true. That's just not true. Let's rise above that, and let's see this for what it is. It's a public health crisis. We may not agree with how our governor and how our state has decided to combat this public health crisis, but it is that, and we are seeing it affect our city. It's happening in our city. For months now, I've been asking you to, and I ask, not demand, not mandate, I'm asking for months now for you to follow the COVID safe practices, to include distancing and avoiding gatherings and using a face covering when you're out in public, and in particular when you're not able to keep 6 feet of distance. And each time I've brought that up, I've cited 4 key components of our community as I see it. And one, our healthcare system, our medical and healthcare workers. Following the COVID safe practices protects them, and it preserves the privilege that we all have, that we could receive medical care should we need it. If we need to go out to the ER at PRMC, we want to know that we're not going to be cared for by people that are overworked and burdened and so forth. So following the safe practices helps protect our healthcare system and protect our healthcare workers. So that's a reason to do it. The second thing I usually point out is our schools. As you know, our teachers and more importantly our students aren't having a great time trying to navigate the distance learning and the hybrid model with schools. We have to get to the place where our kids can get back in school. Our elementary kids have been to school in a hybrid model, but our middle school and high school students haven't been back to school in person yet. So following the practices, keeping the numbers down, helps our schools, helps our kids. Another thing I mention is Cannon Air Force Base. When I speak to the wing commander at Cannon Air Force Base, he relates to me how COVID-19 is impacting their operations. It interrupts their training, it interrupts their missions. Imagine when an airman tests positive for COVID-19 and they do the contact tracing on that, oftentimes it takes down most of that squadron, if not the whole squadron. So they've asked that we in the community follow the safe practices to help keep the numbers down. I think the Air Force, the men and women doing the work of preserving our freedom, deserve that effort on our part. And it's worth doing it for that. And I always cite our local economy, and we're seeing that now with the restrictions that have now come down from Santa Fe, once again, restricting our small businesses. So practicing the COVID safe practices is worth it for public safety, for our schools, for Cannon Air Force Base, and to protect our local economy. But today, with the spike in cases, today I'm pleading with you. I'm pleading with you for all of the reasons mentioned above, but today especially for our healthcare workers. Let's hear their cries for help, their ask for help, and let's do our part to help slow the spread. Let's follow the orders. Let's do the things that we know work. None of it is foolproof. I'm happy to wear a face covering if it means that our businesses can be open, our healthcare system can be protected, and our kids can get back to school. But the face covering by itself isn't foolproof. It helps a lot. So it's worth doing it. But when we use the three things in combination, let's practice distancing, let's avoid gatherings, and let's use a face covering. Doing those things will drastically reduce the spread. It drastically reduces the odds or the chances that I would share the virus with you if I run into you at the store or wherever. If I'm covered up and we keep distance, it's drastically reduced. We can slow the spread by practicing these things. And it'll help take pressure off of PRMC, and it'll get us closer to getting through this. So, moving on, some of the things that we're doing at the City of Clovis, for all the reasons stated above, the City of Clovis and across all 14 departments has already made the necessary adjustments in order to comply with the health orders, and they're taking every precaution to help do our part to slow the spread. A press release went out end of last week detailing all of that. The City of Clovis as an organization is complying, and I and the City of Clovis are asking you to comply. We're requesting that you comply and help slow the spread. You're going to see this week's City Commission meeting held virtually. It's not easy or fun to do it that way, but we're going to do that because we want to do our part to help. Board and committee meetings have been canceled. City facilities are closed to the public. City employees are working remotely, except for those departments which are deemed essential. And all of the city's functions are going to continue in order to continue providing the services that we do to the citizens. Some of the other things we're working on is we're trying to get the CARES money out. You remember recently we talked about the business continuity grant that was created with the CARES funding that came from the federal government. The City of Clovis went after that, and we got $4.2 million for business continuity. And we are doing the work and looking to get that money out real soon to those businesses that applied and qualified for those grants. And we're going to continue carrying out the housing assistance program, also created with CARES dollars. The housing assistance program is being handled by Eastern Plains Council of Governments, and there's assistance for rent or mortgage and utilities. There's also a child care assistance program there, so be aware of that. I'm asking for a new daily update to be started right away. My idea behind this is a facts, not fear, hospital statistics update daily. I think that the people of Clovis need to know the facts and details about what's happening in our community related to COVID-19, and I think the hospital numbers tell that story. And I think that if we report those numbers in a concise manner every day and raise the public's awareness about what's going on with COVID-19, I am confident that the people of Clovis can be trusted to act on that information and do what's right and help our neighbors and help our community by slowing the spread. Next, if at all possible, I would like to offer encouragement. This has been a difficult year. It's been an extremely difficult year. And I would just like to encourage all citizens to be sure and not ignore self-care, to be sure and not ignore your physical and mental and emotional health, and be sure and take care of yourself and get help when needed. Eat a healthy diet and make time for exercise. Stay connected with friends and loved ones, and that sounds silly when I'm also asking you to practice distancing, but I guess I'd like to point out we're asking that you follow the orders and practice physical distancing, not necessarily disconnect from your friends and loved ones. So I think it's important for our mental and overall health that we remain connected to our friends and loved ones. So please pick up the phone and check in with the people in your life. If you find yourself in need of any kind, remember a great resource in our community is the United Way. They offer help themselves, and they also act as a clearinghouse for all of the many, many resources that are available to folks in need in our town. And you can access those resources by dialing 211. Calling 211 will get you to someone that can give you advice about whatever it is that you're dealing with and connect you to those resources. I would ask that we all be patient with one another and be grace-giving. It's easy to find parts of all of this to disagree with one another on. Not everyone agrees with me. And we have friends and families and neighbors who are in disagreement about things and how they're being handled. But let's give grace to one another. We're all doing the best that we can with a difficult situation. And if we disagree on some things, there's one thing we can agree on, and that is we all want what's best for Clovis. We all want what's best for the people of Clovis. We want our friends and our family and our neighbors to be happy and healthy. And this won't last forever. Some of my favorite scriptures remind us how we're to conduct ourselves. And I won't share those with you, but I would just challenge you. Let's make it our goal to think of others as greater than ourselves. It's my goal to think of you as greater than myself, and that means that I would put aside pride, if that's all that's keeping me from wearing this, and think of you as greater than myself. I'm asking you to each do that. Let's think of each other as greater than ourselves. Another favorite scripture of mine challenges us to try and outdo one another in showing love and honor to each other. What if all across our community, we all thought of the other person as greater than ourselves? And what if all across our community, citizens made it their goal to try and outdo one another in showing love and honor? That's my challenge. Let's do that. Let's be that community. One of the things that was new in the announcement on Friday is the governor referenced the fact that at the end of 2 weeks, at the end of this current health order, which goes through November 30th, there would be a county by county approach to reopening, which tells me that we may have some control over our destiny. I find that a little bit encouraging, and maybe that would help you. Maybe that would be the added motivation you need to be disciplined and practice the safe practices. Citizens, let's keep our heads up. Let's find a way to remain hopeful. We'll see where we're at in a couple of weeks. And let's do everything we can to outdo one another in showing love and honor to each other. Thank you.